Hi, I'm Dr. Rishi Desai. I'm the Chief Medical Officer at Osmosis, and on this episode of Raise the Line, we're going to hear from someone who's providing patient care in the epicenter of the COVID-19 outbreak in the United States and frankly around the world. He is Dr. Conrad Fisher, an infectious disease specialist. He's also a residency program director, vice chair of medicine, and chair of the ethics committee at Brookdale University Hospital Medical Center in New York City. He's also a professor of medicine at Touro College of Medicine in New York, and the author of leading publications to help students prepare for the USMLE and specialty board exams, including a best-selling book, Master the Board series. Dr. Fisher also serves as the president of the Mid-Atlantic region of the American Academy of Religion. Thanks so much for being with us here today, Dr. Fisher, and I can't imagine how much you get done in a day. That's incredible bit of background on you. Thank you.
Yeah, well, have you ever met an unbusy doctor, Dr. Desai?
Not too many of them. I think I've met a few. They're usually retired.
Yeah.
So tell us a little bit about yourself and the role you're playing in Brookdale day to day. I mean, you're at the center of this. So what is it like?
Yeah, the most important thing now is because there's so much fear. Now, one of our staff said, please, can we work from home? The administrative staff, the program administrators for the residency program, which I'm director. And I go, my darling, you are not paranoid. Paranoia is when you're afraid of something when no one's attacking you, when your building is riddled in coronavirus, when you have 25 deaths a day. To fear walking in when you have a young child at home, you have a 10-month-old, and you're afraid of bringing that disease home to your child. That's not paranoia. This is a legitimate fear, and we need to talk about that more because the bravery is because people are legitimately afraid. I'm afraid. I was in 10 COVID positive rooms just today.
Oh, wow. And what is that like when you go in there and you're on your 10th one? Are you thinking, I'm likely to get it? Do you think you've ever had it or been exposed to it?
Yes. Well, the fastest thing to understand it is the visual. How do I feel when I know I have to go to a COVID positive floor? Here's how I feel. Now, despite that, what I do is I don't think that you need me to talk about personal protective equipment because everybody understands that. A face mask, you get an N95, the gowning. I personally wear a double gown, one in front, one in back, gloving. I think the thing that to bring here is what I do. Even though I'm a board certified infectious disease doctor, I ask my residents, I go, I want you to watch me putting on my own personal protective equipment, not because I'm such a super genius, but because when people are tense, we make mistakes. And this has to be the Atul Gawande checklist moment where we don't say, I'm so smart, I know better than you. We say, hey, check me. Now, I'm in a hospital now where we have opened up 2 intensive care units. We've opened a whole brand new patient floor. And we have what I like to think is a colorectal surgeon stepping up to run a COVID floor because we had nobody else. And I have the blessing of having the wonderful chief resident in psychiatry acting as my intern because we need the staff. And I say, watch me put this on. Did I miss anything? Am I breaking technique? And one is to use that fear to say, double check me. Number 2 is the wonderful sense of my ashram of people who actually tie my gown behind me to make sure that Dr. Fisher is safe.
Yeah.
So on the day-to-day, everyone is frightened. If you weren't frightened, you have schizophrenia.
Do you feel like, because I've heard about this protocol out of Wuhan as well, where in the beginning, folks were wearing, like you said, just like an N95 and thinking they were good to go. And then they realized how contagious this is and how easy it is to get a little bit of the virus inside. And that can make you real sick, even if you're young and healthy and so on and so forth. And so they've started implementing this policy. And so I'm really intrigued that you guys are doing it too. Specifically having a checklist and having partners where you watch me, I watch you. If I mess up, you let me know, things like that. How widespread is that? Do you know that other hospitals outside of New York are doing that now?
The concept of the checklist, the problem is it's the right thing to do, but we are all making it up, unfortunately, on our own. There are 5,000 acute care hospitals in the United States, and even if you narrowed it down, there are only 395 people like me, which is residency program directors, who have to be conscious of the role modeling that we do. And so there is no centralized plan. There is nothing coming out of our national leaders. There's no FEMA-derived plan. And so we are each left in our own hospitals to try to the best of our ability to do what we think is right from the best data. But how much data is there? So when you said, if I've been exposed to coronavirus, I was diagnosed positive 2 weeks ago. I stayed up, yes. I was tested and positive 2 weeks ago. I was very lucky that our hospital was the first and only hospital for 10 days to have an in-house same-day test.
Oh,
That's
wow.
pathetic. It's pathetic
It is.
the hospitals were all left to verify and validate their own tests.
Yeah.
So no, the checklist is what we should be doing. Are we doing it everywhere? No. Is there a national coordinated plan? No. You have a lot of very hardworking, intelligent, committed people who are trying to do the best they can. But do I know for sure that what we're doing is better or even as good as the other 5,000 hospitals or the other 395 residency program directors? I hope so, but I don't know.
Has there been any effort on the state level? So I recognize that federally this hasn't happened, and that's both sad, disappointing, but also not surprising. How about the state level? Have you seen any sort of coordination with Governor Cuomo's leadership?
Yeah, Governor Cuomo is certainly outstanding when it comes to a stand-up fight like this. He's a strong guy. He provides a sense of confidence because he doesn't sugarcoat problems. But there are things he can't do. For instance, Governor Cuomo, he's very hands-on. He's on with our CEO. How can I help you? How are you doing down there? Do you need PPE? But the guy can't 3D print nurses. And what we're at now, we're at an issue where we have an enormous nursing outage that is very, very desperate. We have 125 boarders in our emergency room are COVID positive patients. Okay? And how do you get through even moving the beds? It's like a Tetris game. And by the way, it's better to laugh than to cry, because if you felt the horror of the situation, we have 10 people a night who die.
Oh my
Three
God.
of my own patients yesterday passed in 24 hours.
Oh my
And
God.
so the governor is doing the best that he can, but he can't just create nurses. And what it needed is a coordinated federal response. If you or I were a captain or major in the Army and we got shot, or somebody that we were in Iraq, our patient would be airlifted out and flown to Ramstein Air Base or Aviano Air Base in Italy or Incirlik Air Base in Turkey or the other places that we have in that region, and we would have been had ill people flown out to where there was medical care. And I do not understand why our federal government cannot fly nurses who want to volunteer to come into New York, and in fact put them through having to go through an agency nurse where they have to go and say, I have to be paid for A, B, and C. So the response should be to put a busload of 50 nurses on a private jet, on a JetBlue plane at our doorstep.
Yeah.
Tomorrow. How about tonight?
That makes perfect sense. And you know, it gets to this whole issue. I think that there's almost two conversations happening. One is this conversation where you're describing the painful reality of seeing people die and the need for nurses tonight. And then this other reality where I think folks are looking at the flattening of the curve in New York and saying, hey, maybe it's time to reopening our economy. We might have kind of gotten past the worst of it. So how do you respond to that? What are your thoughts on that?
If politics could be sued for malpractice, that would be what you would do. You would be suing people for malpractice. You would be telling people that digoxin lowers mortality in CHF, or why don't you just use diuretics, or why don't you just stop the aspirin? This aspirin stuff, it's bad. Let's stop it in coronary artery disease. Now, I wouldn't talk this way if it wasn't so much a physician audience. But this is like telling people to use AZT monotherapy for HIV. It's like saying to use steroids alone for Wegener's granulomatosis. What kind of analogy do we have when somebody makes an irresponsible statement like that? These people are going to die. I'm immune to coronavirus, okay? And we put our frontline people as best we can. I go into the rooms. I don't let the intern go into the room who's not immune. The resident who is immune goes in with me. But this thing about opening up, we have 20 to 25 people a day dying. Do you know what it is to run a code? People don't take that. They take that for granted. Even the senior physicians, you and I, we're the professors. We're not running one code an hour, one dead person an hour. We have to say, Rishi, I'm terribly sorry, but I'm Dr. Fisher. I know you couldn't visit your mother today, Rishi, because there's no visitors allowed. And it must be terribly painful for you to have to be separated from the people you love. And I know that your mother didn't pick up the phone when you called. And I saw you were calling, but she couldn't pick up because we were coding her and tried to bring her back. And I'm calling you back on your mother's phone because I saw your name popped up. And I saw that you're the same as the emergency contact person in the chart. I'm so sorry to tell you that your mother died of COVID virus tonight, and you called just as she lost her pulse. And that conversation is happening 25 times a day in my hospital. And to open up the country for the economics of this is irresponsible.
Yeah, I couldn't agree with you more. I think that it's disappointing that there's still states that never shut down in the first place and have been and continue to stay open even right now as we speak about this.
That what I just relayed to you, that happened 18 hours ago. People called in and the cell phone rang while chest compressions were occurring. And the epicenter of this, Brooklyn, Queens, and the Bronx, we have received no ventilators from the federal government. And our hospital, our leadership is going crazy trying to do the right thing. They're desperate to do anything they can that's right. And they're getting the best support the state can give them. But what we needed was certainly, if we had worked on having a standardized test, our PCR and our blood antibody test would be ready by now, instead of people still scrambling for testing.
Yeah, it's abysmal, and it's gone on for months, and especially the antibody testing as well. You mentioned you're positive, and it would be good to know. I was going to ask you if you knew if you're IgG positive or if you have any sense on that.
I don't know that I'm IgG positive. I'm going to press next week because my outstanding chairman of pathology was gracious enough to go with the pressure, I should say, go with my request, my begging, to get PCR testing for all the staff. I was a very early and prominent supporter of test the staff, get them out of the hospital, keep your 7 to 10 days out, get out, and then you come back. I have a residency program of 93 residents. 33 of them have had coronavirus. I'm happy to say that only 7 are out sick. Take your 7 to 10 days out, come back in. They've either also the residents, man, they stepping up. Even 3 weeks ago, we knew this was going to happen. And we're like, look, you're going to have a vacation now. There's no place to fly to. Will you voluntarily? I go, look at this. I'm not going to order you to. One guy had a wedding with 400 people. I'm not going to order you not to go places. I'm not going to order you. I'm going to ask you to do what's right for humanity. Do what's right. Where there's a love of medicine, there is a love of humanity. And will you consider pushing off your vacation? Every single one of them did it. And the guy canceled his wedding because the guests don't want to come anyway. So they're going out and they're coming back in. And I do wish, though, that we had easy testing for the antibody right now, so we don't just have to assume it. That was today's problem of the day. The other big problem is intubation. You've got to, again, for a medical audience here, you've got to be able to have a capacity, not just to run RRTs, rapid responses. You've got to be able to have capacity to have those anesthesiologists there to intubate. And the problem is they are overwhelmed. You're doing a 10 dead a night means more than one code. That's the negative outcomes. What about being able to get up to intubate those people in 5 to 10 minutes? So that is desperately needed. So we need to change our paradigm, and we now need to immediately train more people to intubate. So we're using our ED residents for that, and we're even asking some of the medicine residents to intubate just as a safety. And they're like, yo, Conrad, come on, you don't want to put that responsibility on the residents. I'm like, I'm not putting it on them. First of all, they volunteered because these people are fundamentally heroic. The other thing is this: think of it like the volunteer fire department. We don't want to replace the pros, but if your house is on fire, I'll take whoever I can get.
Exactly. And I think it's an interesting analogy because I think a lot of people don't recognize that a house is still on fire. I think a lot of folks look at the data and think, oh, maybe the fire is going out. And in fact, I think one of the concerns is that not only is the house still on fire, but it's burning all over the nation now rather than just in one area.
And so let's look at that. Let's look at the DSM for that. A fixed, persistent belief, if it doesn't hurt you, is called delusional disorder, okay? But if you have a fixed, persistent belief and you're not taking care of your activities of daily living, called social isolation, rapid expansion of testing, clinical trials instead of the voodoo of hydroxychloroquine or the QT prolongation torsade de pointe. Hi, I need an AICD. Can you give me hydroxyurea and azithromycin? I want to see if I can get my implantable defibrillator today. So if you want to actually study these things, it's not delusional disorder. It's worse. That's called schizophrenia. It's in the DSM, okay? So those people who say not to study these things with a clinical trial, to just make statements about drugs that are unproven, to not have testing available, to say that more testing is available than is actually available, this is a psychiatric illness.
Well, maybe on that note of a psychiatric illness, I'll ask you, are there any other final thoughts you have for med students and residents that are just entering the fray? Maybe they're not there yet, and maybe their hospital doesn't look and feel like New York, but it might. What would your advice be?
Your calling is sacred, because some people will look at the world and say, how can this have happened? And for those who are believing people, and I don't often speak this way in scientific organizations, and say, how can there be this suffering and pain? Divine and cosmic forces of goodness and truth and beauty and hope reach the earth continuously, but only to the level of the human heart and mind. And the implementation is up to you. So if you want to help me and you're not in a position to be able to send nurses or send PPE, but you wish to help, the fundamental yearning for goodness to help the other people in our community, our world, study medicine, study continuously. Study even the things that are not COVID. Learn about Wegener's granulomatosis. Thank you, Dr. Fauci. Okay? And then what you do is you'll learn about it, and you'll learn, my God, there's an antibody that's developed that attacks von Willebrands I can use for TTP. There's voxelotor for sickle cell anemia. Mechanical retrieval of clot is good for up to 24 hours. Become super current. Because if you're polishing your skills, in the event, the time will come when you will be able to save a life, and you will have protected humanity. And that's who you are, the protector of the world. Fall not into despair, because despair saves neither this world nor the next, Arjuna. But stand up and fight.
That's a very inspiring message. I appreciate the eloquence with which you conveyed it. That's amazing.
Yeah, Sri Conrad Fisherji.
I can see how you're gifted in many ways, Conrad. It's pretty impressive. I well, thank you. Hey, listen, thank you so much for being with us today, Dr. Fisher. I know that your day is very busy, so these minutes that you spent with us are very treasured. I'm Dr. Isha Desai. Thank you for checking out this episode of Raise the Line. You can join Osmosis in raising the line and flattening the curve to strengthen our healthcare system. Go to osmosis.org/COVID-19. Thank you so much. Take care.